Hello, and welcome back to The Road to Recovery, a summer video series about addiction and recovery presented by Project Vision and PEG TV. Today's episode 2, where we talk about treatment options in Rutland County. I am Chadd Viger, CEO of Recovery House, better known as Serenity House or Grace House, and I'm joined by Kathy. Kathy Kinirons is the clinical supervisor of Westridge Center, the Addiction Treatment Center through Rutland Regional Medical Center. Today we want to talk about treatment options, as I said, and I'm going to turn over to Kathy, and she'll give you a rundown of what we're going to discuss today.
Good morning. Today our overview is going to look at 4 main points. We're going to go over what is substance use treatment, look at the continuum of care. There are many options that are available to folks in need of treatment, who needs substance use treatment, and how do you get treatment in Rutland County. So we'll start with what is substance use treatment, and I'll turn that back over to Chadd to start going over what is that.
Thank you. So last week you heard from Clay and Tracy about addiction. They shared their stories. And now we look at how to go from active addiction into active recovery. And the first question we want to answer is, what is substance use treatment? Substance use treatment is a professional, evidence-based approach to treating substance use disorders as defined by the Diagnostic and Statistical Manual number 5. This is marked by continued use despite negative life consequences. Meaning someone is continuing to use alcohol and drugs despite the fact that it's creating problems in their life. Treatment includes levels of care from early intervention, when someone might be starting out with their use, to hospitalization, which would include a medical detoxification process. Treatment is provided on a continuum of care, so it is all depending on individual need, and each level of care provides either more intervention or less intervention depending on that need.
The continuum of care is really important, and the way it's put out here is kind of looking at it from a step model. So if you think about like climbing a ladder, so we can look at it from the bottom level where somebody maybe has started using some substances, and maybe at that point they don't need treatment. Maybe if you look at it from where Clay and Tracy talked about it, is building a support system, maybe having a place to go to talk, like a Turning Point, or maybe they get into an AA or an NA program and just start sharing what's going on for them with their early use, and that may be enough. And so that they may not need a level of treatment like what we're going to talk about next. So that may be good, and that's wonderful if that's what works. So the next step up might be in some early intervention. So they realize the problem is getting worse, and we look at always the earlier the better with any kind of disease or any kind of issue that is starting to create problems in your life. The earlier you intervene, the better off your outcome is going to be. So early intervention could be maybe you speak to your doctor, maybe you speak to a family member, maybe you speak to a pastor or a priest. It really could be anybody, but there could be some interventions there that really start to help the problem, and that may be enough there. So now you've gone up the ladder a little bit, but still the intervention's early and maybe not that radical. That's a good thing. But let's say that is not enough, and then you climb the ladder a little bit further, and now we're at what is an outpatient, or so that's a level where maybe you go and you start to see a counselor. You go into, where you see a counselor maybe once a week or something like that, and they're able to help you to walk through what's going on with your problem at that point. Or you go to what's called an MAT spoke. So MAT stands for medication-assisted treatment. That is where you have developed an addiction to an opiate. So we could be talking about something like heroin, or we could be talking about a prescription pill addiction. That could be, let's say, things that are commonly known, such as oxycodone, Percocet, Vicodin, things like that. So a spoke is a physician in the community, a program where they can help give you a medication that will take care of the addiction in the brain, where it will push out the substances you've been taking, what they call like on the street. So you've been buying it. It'll push that out of the brain and take place of that so that you no longer, if you stop taking the drug you've been buying on the street, you won't withdraw. It'll cover that spot in the brain. So you don't withdraw. You take that legally. You take that as prescribed. You get into some counseling in that same program, and you start to figure out what's been going on. But you're no longer part of that illicit drug world. And a lot of that really helps people to start to figure out why they were doing that in the first place, and they can start to really put their life back on track with use of that. And that works for a lot of people. A lot of people do very well and are very successful in that, for whatever period of time is necessary for them. So there's no set time. It really depends on what you as the individual needs to do for that. And then we'll climb the ladder up a little bit further. If that is not working for you, if you're continuing to struggle, that's not enough, then you can climb the ladder and you can go into an intensive outpatient program, or if you've needed that medication component, you can go into the medication assisted treatment hub. That's a program like in Rutland County, we have the Westridge Center. And that's more of where you go, it's a daily dosing program, so you don't have a script like through the physician you did at the spoke. You go in every day and you get the medication. It provides a higher level of structure. So, where you really need to get a little more involved, maybe the counseling is a little more in depth, which it would be at the hub. And you're just going to get a little more intense treatment than you have been. And that's the same with an intensive outpatient program, where you would be going 3 to 5 times a week to several hours a day, where you're getting more intensive counseling than you might at the spoke, or you might at seeing your counselor 1 time a week if you only needed to do that. So we're climbing again this ladder of intensity of the addiction and the intensity of the treatment that you need to be able to get some higher level support for the addiction that you're experiencing. So your problems have intensified and you're having trouble getting those under control. That's why we want to climb that ladder. The next step up would be inpatient residential and detoxification. So this is a step where you really need to get out of the environment you're in. This is where Chadd's program comes in, for example, recovery house. You're going to go in, you can go in for anywhere, and Chadd will speak more to this later, where you can go in, 2 weeks, 3 weeks, I believe even extensions have gone at times to a month. You're really out of the scenario you were in. You're going to get 24-hour care. You're going to be around other people who need that same type of care. You're not going to be surrounded by those triggers that were really pushing you, where every day you were surrounded by the things that kept you in your use. Multiple groups per day, multiple meetings per day. Again, counselors available to you all day, even overnight support with staff there. And the detoxification, where the substances that you've been taking really need to come out of your system. You need to clear your system so that your body can start to adjust in a safe way. So these are medically managed detoxifications to make sure that you're safe. And then that other level of care above that, hospitalization, detoxification. So this is a situation where maybe you were struggling with alcohol use, and that really might require a hospitalization. Alcohol and benzodiazepines are two substances where the withdrawal can be dangerous. They sometimes can be fatal. So having that done in a hospital setting where you are highly medically supervised might be necessary to make sure that as you're going through that withdrawal, you might have medical complications, and we want to make sure that you have nursing and even physicians monitoring you to make sure that there are no fatal outcomes potentially, just to make sure everything is looking really good for you as you do that, is that highest level of care. So again, what that just kind of tells you is there's availability of support for you at every level that you might need, top to bottom. And even if you have to go to that top level, you can continue to get support as you come down off that highest level. They're support at every level, and you might have to go up and down that, but it's available, it's there, and you can work it any way you need to on those levels. There's no clear way up and down. It varies person to person.
I think availability is a big component to it. One thing I often hear from folks is this element of shame in accessing services at any level. If it's someone starting out in their journey of treatment or someone needing a higher level of care, and I think it's really important to understand that providers at any level want people who need treatment to come in without judgment. And we can work through that shame and get someone started on their treatment journey or continue it with them and get them the help that they need. So we have an understanding of which levels of care are out there and how they ascend or descend in amount or intensity of care. I think it's important to look at who needs substance use treatment. Right. Some folks who watched the first episode might relate to Clay and Tracy. Some folks might say, well, gee, I don't have it in that sort of way. I think it's really important to take a look at each individual person, but there is a structure to kind of categorizing someone's use and helping to determine how much services they may need. So interventions related to prevention and treatment are tied to amount and frequency in a lot of cases of drug and alcohol use. And with prevention, you're looking at preventing persons from maybe ever starting to use or drink, or making sure that it doesn't grow beyond experimental or recreational use. Experimental use of drugs or alcohol is when somebody tries them out of curiosity, whereas recreational use is a little more frequent but still infrequent in comparison to someone who might develop a habituation of use. A habitual use is where you start to see a pattern developing. Let's say someone's drinking on the weekends, every weekend. That's become a pattern that is habitual use. Let's say that same person continues to drink and now it's gone from every weekend to maybe Thursday, Friday, Saturday, Sunday. Maybe it's interfering with their job, starting to create some problems, calling in a little more frequently. That's when we start to see it move from habitual use to the idea of abuse, where it is creating some problems in life. It might not be a whole lot of problems, but it's still interfering with function in some areas of life. And eventually, if that use continues, the person's tolerance might increase, the need for more substances to get the same effect increases, and they begin to use it more often during the week, maybe even daily, and it creates multiple problems in their life in multiple areas, including physiological dependence. That's when someone begins to develop withdrawal symptoms if they no longer use the alcohol or drug. That's when perhaps a higher level of care is indicated. The detoxification process is going to be helpful for that individual to help the body really rid itself of those substances and get rid of the physiological dependence.
Right. Exactly. When we talk about, how do you know where and when you should go? And we're going to talk a little bit about that there's no wrong door for sorting that out, because this can sound really complicated, I think, sometimes. And we'll discuss that we're going to sort that out for people. So hopefully if you're watching this and you say, I think I have a problem, but I'm not sure which of these are right for me, we're going to help you figure that out, because we've done that work for you. And everybody in the community that works together as a program has done that work for you. So we'll be able to work that through. What is important to understand is that even if you don't know for sure which place is right, we want you to understand that there are factors that increase the risk for you, no matter how much or little you might be using. And some of those, we'll walk through some of those quickly, but understand pregnancy. So if you're pregnant and you're using, your risk has gone up in terms of what can happen now, not just to you, but also to the unborn child. And when you're pregnant, you really have not just an open door, but you have an immediate door, because we want to be there to help you right away. Okay, so one, know that the risk is great. So discontinuing your use, and if medication-assisted treatment is something that you're interested in, it is also it's also evidence that it's a great way to get support and help right away. And you will be brought in right away. So I just want you to understand that. IV drug use is also a really a high risk factor for not only health issues, but for overdose. So using through IV, if you're an IV drug user, understand that your risk for overdose is very, very high. In the Rutland community right now, we are seeing a huge uptick in fentanyl, and in fentanyl coming in the form of other things. So fentanyl in cocaine is extremely rampant in the Rutland area. I'm sure we're not the only area, but we want you to know that that is happening quite often. And that's part of the mixing substances is in this list. So that's part of what we're seeing a lot of right now. So two pieces that are also commingling right now is isolation while using and the COVID-19. So isolation while using is always dangerous, because if you're doing it alone and you're at risk for overdose, obviously then if you're at risk for overdose and you're by yourself, knowing that now Narcan is widely available, and that is a way that if you're overdosing, you can be saved. If you're by yourself, most people aren't able to bring themselves back because you could go over the edge so quickly, you don't recognize you're overdosing. COVID-19 has increased that isolation to such a large degree that overdoses have been on the rise. So we thought it was really important to talk about the world we're in today is such that isolation has increased. So again, we're kind of putting those equal signs together, that COVID-19 equals isolation for a lot of people right now, because that has been the standard of social distancing and not being around a lot of people because of fear of the virus. So just understand that Narcan is available. We have information at the end of this presentation so that you will know where you can go. Most people do know where it is, but we're going to have a list of where you can call, what you can go to be able to access information about Narcan and where you can receive Narcan. But again, understand that these are high risks. Call the programs that we're going to list, talk to them about where you can go for help. And just understand that right now we're in an even more precarious situation than ever before. This is new to everybody with COVID-19. Support is available. Waiting lists are down. All of the programs that we've been speaking to, it's a little tougher with residential, and Chadd can speak to that. But a lot of the programs that we've been talking to have availability. So you may think it's not safe to call programs right now, that there's no way to get in because of social distancing. We happen to know that there is openings, okay, and it's safe. We've made adjustments. So the programs we're going to talk about and list for you, there's space. If you need help, call, reach out, and we're available for you.
Absolutely, and this is a good transition into talking specifically about what these programs are doing to address COVID-19. I've talked to some individuals who were hesitant or reluctant to seek treatment due to the fear of being exposed to COVID-19. And as Kathy mentioned, a lot of programs, all programs that are operating are adopting policies and procedures aimed to reduce the risk of infectious disease spread, such as COVID-19. So some things that COVID-19 has a negative impact on, really isolation and fear. Like I said, folks fearing going into treatment that they might be exposed. Folks isolating while they use or drink certainly increases risk, as Kathy mentioned. We want to break down these barriers for individuals, and that's part of the reason why we decided to include this in today's discussion. One thing that might be helpful is if you are interested in treatment and you are uncertain about level of safety or risk of COVID-19, I would encourage you to call the program that you're interested in to see what they're doing. For example, in a residential setting, I know that Serenity House is asking folks to get tested before entering into treatment. And once in treatment, individuals are wearing masks. All staff are wearing masks. We're trying to physically distance. We're reducing contact points for multiple people. Our group sizes are much smaller now. So we are taking precautions to help reduce that risk. Another thing to consider with COVID-19 are ways to stay safe. Kathy mentioned Narcan. Narcan saves lives. That's just as simple as it could be put. It does. If individuals are still using, I would encourage them to reach out to providers that can give them access to Narcan. If not for them, then for potentially somebody else who is near. Telehealth has exponentially increased since the start of COVID. More and more providers are seeing people via Zoom or another virtual platform or contact over the phone. And self-help meetings as well are being done via Zoom as well. So if there's any fear about attending an AA or NA meeting or Smart Recovery meeting, I know that Zoom has been a good place to turn. I would encourage you to go to the websites affiliated with whichever program you're interested in. Other programs, I'm thinking about outpatient, Kathy. Mm-hmm. I spoke a little bit about residential. I know outpatient programs are have prepared for COVID and are addressing it through certain measures that they're taking. Can you speak a little bit about maybe some measures that you're seeing in the outpatient world?
Yeah, so I think it's the same, like with Westridge, we're outpatient, and when patients come to the door to come in, the first thing they do is they are already wearing masks, or we provide them with a mask. They get a temperature check, and they're asked the questions of, are you exhibiting any symptoms such as? And if they are, we're pointing them to getting screened. And if they're concerned about symptoms, or if they've had to leave the area to go to a higher level, COVID-related area, then we offer curbside dosing. So they don't miss a medication day if they've had to go to a higher level area. So we're making sure everybody is safe. Physical spacing, same as you said with groups. I know that Evergreen is doing the same thing. For quite a while they were doing Zoom groups. I know that they have now brought some groups back in and are doing spacing in their group rooms and still offering Zoom even through that. So you can morph the two. So everybody is really being creative, which is needed, but making sure at the same time that people are getting the services they need, because the counseling component, these are evidence-based practices. Individual sessions, group sessions, family sessions is all there to support the patients in identifying what they need to do to make sure that they are working on the issues related to their use. And it's a different level of support than peer support. It's a professional, these are professional programs aimed at addressing the issues related to their use and other aspects of their life that have needed improvement. and they've needed to continue. So, you know, it's been a time of creativity to make sure people are getting the help that they need. There is no wrong door. Project Vision has brought all of us together in a really creative and inventive way, and we now all know how to screen, we know how to refer. So if you called Westridge and what you needed was residential, we know how to get you to connect to Serenity House, and vice versa. And it's the same with all the other programs that we're connected with. Turning Point is the same way. You go to them for peer support, they'll connect you with peer support, but if you need more, they know how to connect you with the rest of us as well. So that's what I was saying, is you don't have to do that work to say, where do I go? Because even if you called one of us and it wasn't exactly the right place for you right then, we know what to do to get you where you need to be. So that's the really important part, is that we're all trained in screening and referral. We'll get you where you need to be. So don't worry about that. That's something that we're going to do for you. So, you know, area providers, Serenity House, Westridge Center, Evergreen Center, there's multiple outpatient programs, you know, that we don't have right here, but again, call Vermont HelpLink. That number is going to be posted. There's a whole list of forensic counseling, Bradford Psychiatric Associates, Community Health of Rutland, Brandon, and Castleton. All those numbers will be listed for you. Vermont 211. So really, again, no wrong door. Just pick up the phone. Call somebody if you need help. We're all here to help you.
Absolutely. I think one point that you touched upon in there is the idea of what to expect when you enter into treatment. And each provider is different. Each provider does share the same common goal of bringing everyone into a state of wellness and recovery. Each program has their own ideas of how to approach treatment, and each clinician has their own style within that. So I would encourage you, if you feel as though treatment hasn't worked for you in the past, to give it another try, to find a program that does work for you. And some things that you can expect, as Kathy said, individual counseling, group counseling, mutual support within the program and other attendees. Other programs have groups that might not focus specifically on relapse prevention skills, for example, but perhaps a different skill that's going to be helpful in your recovery. So finding groups that you feel are helpful, finding a counselor that you feel is helpful is a part of the process, and I would encourage anyone to reach out for help. We are here, as Kathy said, and we will be waiting to help you.
Please don't hesitate. It's a really hard time in the world right now. The last thing you want to do is to isolate yourself in any kind of suffering or pain. You don't need to do that alone. There are many ways to get connected right now. So please get connected. Again, multiple supports, and we encourage you to do that. We can work together and figure this out, and you can get help, okay? So that's what we'd like to do. And we encourage you to do so. Thank you for your time today.
Yes, thank you.